Hello and welcome to Med Simplified. Scabies has been known to mankind for more than 3000 years. Scabies is an ancient worldwide disease affecting all races and social classes in every climate from Arctic to equatorial regions. Scabies is caused by a mite which lays eggs in the human skin. These eggs then hatch and grow into adult mites which repeat this cycle. This means that the signs and symptoms of the skin condition can last for months or even years if not treated properly. In this video, we will take a brief look on the organism that causes scabies, its signs and symptoms, and then we will talk about how to treat scabies. So let's begin. Scabies is a very common disease and globally more than 200 million people are affected every year, with a particularly high prevalence in poor tropical regions. It is an important public health problem worldwide and can occur at any age, affecting both males and females equally. Now let's talk about the organism responsible for scabies, which is basically a mite known as Sarcoptes scabies. Humans discovered this mite in the 17th century, and scabies mite has been mentioned even in the Old Testaments of Bible and many books of Shakespeare. You would be surprised to know that human scabies was the first disease in which the causative organism was discovered by using a microscope. This mite is oval, pearl-like white organism with lots of legs and special structures on their legs known as suckers. At a time, about 10 to 12 mites can affect an individual. The life cycle of the mite is completed entirely on human skin, and it starts when a pregnant mite attaches on the skin. This female mite digs up a tunnel-like structure on the human skin which is known as a burrow. This burrow can be up to 1 centimeter long, and the mite lays her eggs along this burrow. Each mite can lay up to 50 eggs during her life cycle. These eggs then hatch into larvae in 3 to 4 days and escape the burrow. The larvae then transform into next stage in their life cycle known as nymphs, and in the next 4 to 7 days these nymphs mature into adult males and females, hence completing the cycle. The burrows of the mites are often visible as very thin lines, mostly less than 1 centimeter in length. Often, scratching of these itchy burrows results in bacterial infection of the skin, so-called secondary bacterial infection. The scabies mite are capable of surviving in the environment outside of the human body for up to 3 days in normal room conditions. Scabetic infestation can be classified into classical scabies, which is the most common form, and animal transmitted scabies, which is acquired from animals like dogs, horses, etc. And lastly, we have crusted scabies or Norwegian scabies. Here the host may be colonized with many millions of mites. It is the most severe form of scabies and happens in people with weak immune system, such as those caused by infections like HIV, blood cancers, or chronic use of steroids or other drugs that suppress the immune system. Now we will discuss about the risk factors for transmission of scabies. The risk factors for transmission include poverty, overcrowding, poor hygiene, poor nutritional status, homelessness, dementia, and immunosuppression. You can get scabies by coming in physical contact for a significant amount of time with someone who has scabies, or you can also get scabies by using the same towels, beddings, clothes, or other fomites used by someone who has scabies. How do you know if you have scabies? So let's talk about the signs and symptoms of this disease. It can be asymptomatic for the first couple of weeks, but the hallmark of the scabies is severe itching that usually worsens at night and typically appears 4 to 6 weeks after the initial infestation. In addition to itching, you can have skin lesions in the form of tiny red bumps that are usually present over the webs of fingers, inner aspects of wrists, underarms, umbilicus, and periumbilical region. It can be anywhere on the body except on an adult's face. But in infants and elderly, all skin surfaces are susceptible to infestation. The patients also gave a history of similar complaints in family members and close contacts, which is very common. Now let's talk about how is scabies diagnosed. Diagnosis is mostly clinical and is based upon typical signs and symptoms that we have discussed previously in this video. Typical symptoms, typical site of involvement, typical appearance of skin lesions, all of which we have already discussed in the earlier half of this video. Also, not to forget, history of similar complaints in family members or close contacts is very common. The definitive diagnosis is made by microscopic identification of scabies mite, eggs, or fecal pellets, also known as scabula. Now coming to the last part of this video, here we will discuss what are different treatment options we have for treating scabies, which can be basically divided into topical drugs, which are creams and lotions applied over the skin, and oral medications. Topical medications include soaps, body washes, lotions, creams, and gels. We will look at them one by one. The list of topical agents used are permethrin 5%, crotameton 10%, lindane 1%, or benzyl benzoate lotion. Permethrin 5% cream or lotion is the most commonly used first-line topical therapy for treating scabies. Permethrin kills both the adult mite as well as the eggs and is therefore highly effective after a single application. However, in practice, the prescribed regime often involves 2 applications, which is to be applied to the full body from neck down, and 8 to 14 hours of contact period is required. So we generally tell our patients to apply it in the night and wash it off in the morning. Benzyl benzoate has been used in 10 to 25% preparation in many countries, including Europe and Australia, but its use is limited by severe skin irritation. Crotameton 10% has been favored in children due to its low toxicity profile. However, it has limited efficacy and multiple applications are usually required to achieve a satisfactory response. So these were the topical drugs that are applied over the skin for treating scabies. Now let's look at the oral drugs that are used for treating scabies. The most common oral drug that is used is ivermectin. Ivermectin is prescribed as a single dose of 12 mg for adults and 6 mg for children below 10 years of age. Often a second dose of ivermectin is given after 14 days. A second dose is required to kill all the eggs of the mite, which can hatch after some time and can lead to a relapse. Moxidectin is a newer agent that is being used to treat scabies. It has better retention in the skin and a much longer half-life than ivermectin, meaning that a single dose may be enough to eliminate the complete infestation. It also appears to prevent reinfestation for a longer period of time compared with ivermectin. To relieve itching, patients are also given anti-itching medications like cetirizine, levocetirizine, and other antihistaminic drugs. In my experience as a dermatology resident, 2 of the most commonly used treatments for scabies are topical permethrin 5% and oral ivermectin. Both has comparable efficacy and are generally very well tolerated. Now, let's look at some of the lifestyle modifications you should do to prevent scabies and its relapse. You need to kill all mites that may be present on your clothing, towels, and bedding by doing one of the following. Wash them in hot water and dry them in a hot dryer, or keep them in direct sunlight for at least 2 days. And the items you cannot wash, wrap them in a closed plastic bag and keep them in sunlight for at least 3 days so that all the mites die. Always remember that a good personal hygiene is the most important thing you can do to prevent scabies and its reinfection. I hope you liked the video. If you found this video helpful, make sure to press the like button below and subscribe to our channel as we upload health and fitness related videos every week. You can also consider to hit the bell icon next to the subscribe button so you can get notified when we release our new videos. Thank you so much for watching and see you in the next one. Till then, take care. Bye bye.